Hey guys, and welcome back to my channel. For those of you who are new, my name is Nicole. I'm a registered nurse who works in a urology ambulatory clinic. I also have experience as an inpatient nurse on a medical surgical unit. On my channel, I talk all things nursing, lifestyle, and personal finance. So if you like those types of things, please hit the like and subscribe button below to catch new videos every week. So today we're going to talk pros and cons of inpatient nursing. I myself just transitioned from inpatient nursing probably about 3-4 months ago. So it's pretty fresh in my mind, pros and cons. I did think about that before I left. So today we're going to go over those things and hopefully this will be helpful for you. Alright guys, let's get started with some pros. So the first thing we're going to talk about is a 3-day work week. Now, when you first hear that, that sounds great, 3 days, but those 3 days are 3 12-hour days. And anybody else who's ever been in the nursing field knows that it's not exactly 12 hours. So, usually you get in there probably about 15-20 minutes before your shift, depending on, your workflow or how you prefer to get started for the day. And then at 7 o'clock, typically we work 7 to 7. At 7 o'clock, that's when the other nurses need to be there by. The pro of inpatient nursing is you learn a lot in a short period of time, especially med-surg nursing. You get a lot of people who have liver, pancreas, kidney, you name it. You get everything on the unit. Dementia especially, we all love our dementia patients. So it's a good place where you can start. If you're a new grad, then you can start there and you get to learn a lot of different things. And if you don't know what specialty you want to go into, which was my problem, then it gives you a better idea of all the different things that you can do in nursing and branch out and maybe pick a specialty that you're interested in because you've dealt with specific patients in that specialty before. The next pro is you get to see a lot of interesting things. So, for example, my most interesting thing I think I've seen is I had a patient who had a low blood sugar and they could not get access anywhere on her. They couldn't get an IV in her with an ultrasound. Nothing. They did everything they could and they couldn't do it. So they actually had to put in an IJ at the bedside, which typically these patients go to IR for. But in this case, it was necessary. I believe her blood sugars were in like the 30s. So she was pretty critical. We couldn't get anything in her to help raise up her blood sugar. So this was something that I got to sit in on. They had all the sterile drapes in the room. We had A beds and B beds, so we had 2 patients in the room. Obviously, I don't remember at the time, but I think they took the other patient out, and we had all the sterile drapes. So it was pretty cool to see. You can see a bunch of different things when you're inpatient, a lot more critical patients than if you were outpatient. And the last pro I'm going to talk about is nurse residency program. Now, I'm not sure if all hospitals have this, but in my specific hospital there was a nurse residency program. It was actually pretty new, but I was able to go through it as a new grad. So what it was is your whole first year as a new nurse, you got to go once a month and you got to meet with all these other new grads that were going through the same thing that you were going through. And there was a bunch of educational sessions and you were able just to kind of do a little journal as well. It was one of the activities, and you got to look back and see yourself grow as this nurse. What you were worried about when you first started, it wasn't even a thought on your mind at the end. So it was so nice to, talk with other nurses, and it actually kind of helps because these other nurses might be in a different specialty or might be in a specialty that you might like. So you get to talk with them and ask them questions, and it was just a really good educational experience as well as a good place to socialize with other nurses in the hospital. So we're going to talk about some cons of inpatient nursing next. I kind of touched on this when I was going over the pros, but you're very tired on those other days of the week you have off. So if you work 3 days, you have 3 on, 4 off, 3 on, 4 off, you're going to be tired. It takes a lot out of you to be running and going all the time. So that is a con. Another con would also be that it's very stressful. So if you're someone who likes that fast-paced, stressful situations, inpatient nursing is perfect for you. If you're someone who gets anxious and doesn't really like when it's fast paced. It makes your day worse. Inpatient nursing might not be for you. A lot of times the patients are critical. They need a lot of TLC that you don't always have time for. You might have a very heavy patient load and you don't have time to spend with the patient in room 5 because, well, there's another patient down the hall that is close to needing to go to the ICU or needs more care than they do. And it's kind of upsetting because as a nurse you want to give them your best care you possibly can, but it's not always realistic when you have heavy patient loads. Patient population also factors into cons of inpatient nursing. Depending on what specialty you work, a lot of times I'm going to talk about med-surg because that's what I have experience in. But in the med-surg population, you get a lot of dementia, which I've spoke about before. People, you get all walks of life. And that can wear on you. People aren't always appreciative. They don't always say please. They don't always say thank you. And as a nurse, they kind of think of you as kind of your own servant. In some days. Some people are very appreciative, however. There are very sweet patients, and that's what makes nursing rewarding. But there's always a flip side, and there's always going to be those patients that you're dreading to take care of. You don't want to go in their room. They've had the call line on multiple times. But as nurses, we need to just take it as it is and know that they're sick and that they need us and try to just look at the positive of it. But it's definitely a con of inpatient nursing, having to deal with those difficult patients. Those are my pros and cons for inpatient nursing. And if you're a nurse and you have a pro and a con of inpatient nursing, please leave a comment below. We would love to hear from you. Stay tuned for more videos every week, and I'll see you next time.